Hey folks, Blair from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Today's video blog topic is tennis elbow. How many of you out there, when you go to grip and lift something, get pain in your lateral elbow? This is a really common injury that we all get as we get older because we get fraying and tearing of that tendon. Now, when I first graduated 33 years ago, we did lots of stretching, massage, ultrasound. Everybody got better in literally 6 weeks or 6 sessions, and we'd send them out and say, good luck. And they'd come back 3 months later and say that darn pain is back again. So the big difference what we do now to what we did 30 years ago is called eccentric loading. So if you load the tendon, and this was first discovered about 15 years ago, we did a lot with heel drops for the Achilles tendon in the back of your ankle. We now do that loading exercise for the tennis elbow. So we're just doing a little drop exercise like that, and it pulls on the tendon. That causes thickening and growth of the tendon, which will help give you a more durable outcome. So now when people get this, if they go through the 12-week drop program with their wrist curls, then there's less chance of them having it flare up again because it physically grows the tendon. Because with tennis elbow, you have a tear and you have swelling and bleeding for about 3 weeks. That's the itis of tendinitis. But after that, it's called tendinosis, which is basically a broken down tendon. If you don't load the tendon, you're left with that broken down tendon, you're at high risk to injure that tendon again. So make sure you're doing your eccentric loading exercises with your physio to help rebuild that tendon. So that's the pro tip for today. So do your loading and have a higher success rate. All right, take care. Bye-bye.